I'm Marissa, and I'm going to be talking about assessment of muscle tone. Before I begin, I would like to say that the information I used has been altered and came from Dr. Christy Daniels' lecture and PowerPoint on assessment of muscle tone. Let's go over some definitions. First, the definition of muscle tone, which is the continuous mild contraction of the muscle or the muscle's preparedness to contract when the signal comes. The next definition is flaccidity, which is the absence of any muscle tone in that limb. The limb seems dead and heavy, and when the client is asked to contract that muscle, it does not. The third definition is hypotonicity, which is decreased tone. It is not the complete absence of tone. However, the limb seems soft and floppy, and the movements are not well controlled because the tone in the muscle is below the amount needed to perform a smooth and controlled contraction or movement. Now we need to discuss what normal muscle tone is so we can understand what abnormal muscle tone is. Normal muscle tone is the happy medium between hyper and hypotonicity, and it allows for smooth, controlled muscle movement and contractions. It requires input from the motor cortex, basal ganglia, vestibular system, spinal cord, and cerebellum to perform these controlled movements. Areas such as age, lifestyle, such as like what job you did, if it was manual labor or a desk job, and genetics can all affect muscle tone and how it changes throughout our life. Now we are going to discuss what abnormal muscle tone is. We previously defined flaccidity and hypotonicity, which is abnormal, decreased muscle tone. This can be caused by damage to the nervous system through central nervous system damage, such as a stroke or traumatic brain injury. Brachial plexus nerve injuries in the peripheral limbs can also cause an abnormal tone, so the nervous signal is not getting to the muscles effectively. An imbalance between antagonist and agonist muscles can also cause abnormal tone. For example, if an antagonist muscle is hypotonic and the agonist muscle has hypertonicity. An important factor to consider is that one joint does not determine all. So therefore, as a therapist, it is important to assess each joint in the body to determine if it has abnormal or normal muscle tone and which type. Now we're going to get into the real meat of the presentation, which is the actual steps to assessing muscle tone. The first step in assessing muscle tone is to record the test position in which the client is in. This could be supine, sitting, gravity eliminated, maybe they're leaning to one side. You definitely want to record this position so that when you go to reassess them, they're in the same position to ensure that the results are valid. It is also important that if you're assessing trunk, like such as scapular tone, that their feet are flat on the floor if they are sitting. The second step to assessing muscle tone is to be sure that you are grabbing the limb by the lateral prominences. So that is the bony prominences. You don't want to grab them by the muscles because your touch can cause a input to the muscle, which can affect tone, either cause it to have more tone or less tone. Either way, you are stimulating that muscle, and that can affect the results of the assessment. The third step is to first slowly move through passive range of motion with the limb that you are, or the muscle that you are testing. The client may be nervous, so you need to remind them to tell you if it hurts, and then begin to move the limb through passive range of motion slowly, and if pain is indicated to stop at that point and record where the pain occurred. The fourth step is to replace the limb into resting position and ask if the client is in any pain. If so, record where that pain was occurring. The fifth step is to quickly move the limb through passive range of motion. This is joint specific. The elbow and wrist are appropriate for this step, but the shoulder is not appropriate to move quickly through range of motion because of the risk of impingement or further injury. If you are doing a appropriate joint, you would want to move the joint through the passive range of motion, the same plane that you had previously done, in a faster motion to see if you can elicit a stretch reflex or a catch in the muscle. If you feel any catches in the muscle, you want to record these and where it occurred. Step 6 is assessing whether you did catch a stretch reflex in the muscle. If so, record this. Please note that these are common in clients with muscle tone spasticity. Step 7 is to, again, determine where in the range of motion did you feel the catch. You can move the client through the range of motion again to reassure that you wrote down these correct spot in the movement where this occurred. Step 8 is important, and it is to label the tone according to the chart found from the Pedretti book. So mild tone would indicate a stretch reflex or catch occurred as the muscles were coming to end range or the end of the movement you were putting them through. Moderate tone would indicate a stretch reflex occurred in mid-range of the movement, and severe tone would indicate a stretch reflex when muscle tone is in a shortened or beginning range. A few other important factors to consider when assessing muscle tone is to be sure to avoid manual muscle testing if a client has hypertonicity, which is increased tone, because this type of pressure on the muscle will actually increase the tone further and skew the results of the assessment. Now that you understand abnormal and normal muscle tone and how to assess it, I also wanted to explain some of the possible causes that can cause increase in muscle tone in patients you may see. Some things that can cause an increase in muscle tone would be tight clothing, a urine catheter, constipation, ingrown toenail, positioning, bed sores, any type of thing that could restrict the muscle and possibly leave it in that position for a long time can cause increased tone, or it can be specific to the disorder or diagnosis they are experiencing. As a therapist, it is important to understand some factors that can impact muscle tone either during your assessment or just throughout the therapeutic process. Fear, anxiety, temperature extremes, heterotrophic ossifications. These can all affect muscle tone and either decreasing or increasing it depending on the client. Other things such as sensory overload or challenging activities such as walking or standing up can cause a different reaction to different muscles. So it is important to understand these and take them into consideration when assessing your client for muscle tone. I hope this video has showed you the basics of assessing muscle tone as an occupational therapist. Thank you, Dr. Daniels, and I will see you in class.